Hi, I'm Peter Boudreau. I'm one of the occupational therapists here at the Rehabilitation Institute of Oregon in Portland. And today I'm going to be showing you how to do electrical muscle stimulation on a stroke patient using the twin stim device. The advantage of this device, if it's used in addition to a good rehab program for a person with a stroke, is it'll help the recovery of the arm. Couple of things, contraindications: you would want to have a doctor's order to do this, and a person who has a pacemaker or a woman who is expecting a baby would not use an electrical device like this. So anyway, talk to your doctor before you use one. The goal of this is to, in this case, we're going to focus on the muscles of the forearm, and typically for a stroke patient they improve in all the muscles that pull into the body, and we're going to focus today on a muscle that tends to be the last one to get better, and that's the muscles that open the fingers and extend the wrist like that. So we're going to focus on that one today. The advantage of doing this is it will prevent, or it'll prevent that muscle, those muscles, from atrophying. It will often, after a stroke, these muscles are overactive, so it'll inhibit those overactive muscles and balance it out with strengthening the extensor muscles. And it will help the brain plasticity, in other words, the muscles in the brains talking to each other again. So that's the advantages. The device we're going to use today is the twin stim, and this one is a good device in that it's not very expensive and it can do some simple things. It's only about, I'm recording this in July 2019, and it's only around $40. You can find it on the internet. I'm going to show you, as if you bought it out of the box, how to program it for this particular stimulation. So this button turns it on, and we're good? Good. Now, this device can do two different things. It can either stimulate muscles, or it could be used as what's called a TENS unit to help with pain. And we're not going to talk about that second part today, but we're going to focus on stimulating the muscles as if a person has had a stroke or a brain injury. But to switch over to the TENS unit, you press the M, and you can see it's lit up on this side, TENS. Press M to scroll back. Now on this side of the screen, you can see it has an S, an A, and a D. And we're going to focus on the S simultaneous. So if I was stimulating my wrist and finger extensors and my elbow extensors, my triceps, I would have it on the S. So it'd be stimulating this and this at the same time to get a nice elbow straightening, finger and wrist straightening. So that's the S. The A is alternating. So let's say I had it on my biceps and triceps. It would engage the bicep, relax, engage the tricep, relax. So with kind of a delay in between. The third option, and we're going to do another video with that one, this one's a good one for working on hand grasp and release. It's called delay. So I won't talk to you too much about that because we're going to do a whole other videotape on that one. But we're going to start simple with this one today. Now, to program this, well, let's say it's on here. If I press S, you can see the S is flashing. There's an S here that's faded because we've pressed it so much. But to scroll over to the A or the D, I could use any of these buttons to scroll through. But we're going to leave it on S. I press this S button right now, and you can see the clock is flashing. And my first session with the patient is likely to be, and I could use either of these to increase the numbers. My first session with a new patient might be 15 minutes long. If they're tolerating that well, I might go up to 20. If they're not tolerating it very well, I might drop down to 10. But anyway, these will increase or decrease the numbers on the screen. I'm going to press S again. Now, this says PW, which means pulse width, and the thing that we default to is 300, and what that means is 300 microseconds each pulse. So you can see that has a 300 on it right now. And each pulse of electricity to stimulate that muscle is going to be 300 microseconds. I press S again, and it's flashing under pulse rate. And it's on 1 right now. I'm going to bump that up to 35. In other words, it's going to send the pulses at a rate of 35 pulses per second. If I had it higher than that, it would probably wear out the muscle. It would be a stronger contraction, but it would be very tiring. So on this page, for my first stimulation, you can see it's going to be in the simultaneous, the S. It's going to go for 15 minutes. Each pulse is going to be 300 microseconds long, and there's going to be 35 pulses per second. I'm going to press S again. And here I can choose how fast it ramps up. Now right now it's on 1, which means it would be 1 second from relaxed to opening. And I want it a little slower to that. If I had a sensitive patient, I might stimulate it in 3 seconds, maybe 4 seconds. But 2 is pretty typical to go from relaxed to opening. And you'll see that when I do it on myself. I'm pressing S again. This tells me how long each of the stimulations are going to last. And I'm going to have it at a 1-to-2 ratio, 5 and 10 for my first session here. So I'm going to increase this so it's going to stimulate that muscle for 5 seconds. I'm pressing S, and it's going to relax for 10 seconds. Let that muscle recover. If I had it like on 5 and off 2, it would wear out too quickly. So that's programming all that, and when I press it one more time and I get a screen like this, that means it's ready to go. Next I'll talk a little bit about the electrodes. And for a person about my size, the 2-inch is a pretty good choice. If I have a patient who's bigger, I might use a 2-by-3-inch electrode. And we're going to put it right over the muscle belly that raises the wrist and opens the finger. We'll see how good we do with that. So 1 is right there, and the black one is there, and then the red one, the ground, will be just, and you wouldn't want it to be within an inch of each other. This one will be right about here. So the stimulation is going to come in the black electrode, travel down and make a loop through the arm. Now if I had a very skinny patient, I wouldn't want them too far apart because it could go in, go deep down to the flexors, and you may get the opposite of what you're intending for. Now, I need to make sure I've got my wires correct. This is easier to do on a patient than yourself. Good. All right, so we're ready to go. Now, when you do this, you're paying attention to the numbers, but you're also paying attention to what the arm is doing. So I'm going to have them side by side so you can see. Now this will increase the stimulation Now right now I can feel a little electrical buzz right where the electrodes are. I'm not getting any actual movement yet, and we're at an 8 right now. Probably you're going to see a good motion for me at around 15, 16, 17, 18. For patients, you may have to go up into the 20s. Some, it varies quite a bit. And the more the patient drinks, let's say water, the better the electricity will conduct. So it'll be a little bit more active that way. So we're at 8. Oh, and because I was talking, the screen went green and it's locked out. To unlock it, I'm pressing the down, one of the down arrows. Now I can go up again. So I'm at 8, 9, 10. So you can see I'm starting to get thumb. We're at 15 right now. Good. Now if I got this with a patient, I would say that looks good, and I would probably leave it there. Now one thing you may have just noticed is that it built it up slowly, but it dropped it down fast, and that's just one of the characteristics of this particular model, is that it turns on slowly. So that's about 2 seconds from relaxation to opening, and then down again. It kind of ramps down pretty fast. Once the screen has gone to the green color, that means that it's in its rotation. And I don't know if you can see on camera when, right now it's at 0, and you know, when the rest time is over, the numbers will start to build up. So that looks good to me. Now with a patient, let's say they've got a little bit of, like some stroke patients can close their fingers, I would probably have them at that point spend maybe 5 minutes just working on this. And one thing I might have them try is, when the stimulation stops, see if they could keep the hand there. So start trying to get some intention to it. The downside of this is it works somewhat passively, and you want to get the brain and muscles more actively engaged. So let's say it's here. I just did that myself, but let's say the machine turns it on and I try to maybe make the motion bigger, or I try to have it not drop down so fast but use my own muscles, which I'm doing now. Obviously I can do that easily. So that's how to set this up. Now let's say it's on and you've turned it up way too high and you're saying, ow, 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 that really hurts. What you could just do is pull the plug, and that's going to cut the stimulation right away. Another way to reduce the stimulation, let's say I've got it here, but that's a little too painful. All I have to do is press the down button, and that will start easing it down a little. Now if I wanted to turn it off, I would press the down button and then the M, and that cuts it off pretty fast. It's much faster than hitting the power button. In fact, you have to hit the down button first. So to turn it off, I press either of these down button, well, this down button, and then the M, and you can see it cuts it off right there. To turn it off, you have to hold the button down about 4 seconds or so. So to review, that turns it on. It's already been programmed, so I don't have to do all those button pushing. It's all ready to go. And to turn it up, I often have the patient do it themselves, so they have control of how much stimulation it is. So we're at 10 right now, and you can see my forefingers starting to quiver a little bit. There. Now, if you get a movement that's not quite right, then you're going to start playing around with where those pads are. let's say I'm going to muscle it over, but let's say I got this with too much movement this way, I might, and I'm hitting too many of the muscles on this side of my forearm, I might move it this way. If I've got them too far apart and I'm getting the opposite, I might do this. But if you look at my arm and maybe copy something just like that, once you find the sweet spots on yourself or the person you're using this on, you may want to take a picture of it or just make little marks so you know next time to try that. If they're a big person, maybe a heavier forearm, you may have to use a bigger electrode. Now, once you have it working, the next trick is turning it into function. So let's say I have a little bit of finger closure. I'll practice with the patient, having them open and maybe reach, and reaching down is the easiest thing to do. Reaching up is quite hard. So I'll wait for the next cycle. I'll have them reach down, which is a good pattern anyway. I'll present something for them to hold on to. Wait for it to relax. Okay, now squeeze it, and hopefully they have enough power for that. And sometimes I'll use what's called a tenodesis assist. So I'll cock the wrist back, which closes the fingers. And then the machine just opened to release. So I'm practicing grasping and releasing, grasping and releasing, because I want the brain to be thinking about those muscles and those movements. If they've got some elbow, and if I had, let's say, a cracker, so it's opening, and let's say this is a cracker, I'll have them grasp it, bring the cracker to their mouth, maybe take a bite, bring it down, and then wait for the machine to release it. There. So what we're going for is a reach, a grasp, and a reach, extension, grasp, and then release again. So when I have a new patient, we might use this one time a day, maybe 2 times a day for 15 to 20 minutes, and probably about 5 times a week, and then increase it from there to go up to 30 minutes, 2 to 3 times a day. The more this is on, up to a limit, the better, because it's more of a marathon than a sprint. So ideally, you're getting up to maybe 2 or 3 hours a day with this, just to retrain those muscles to come back. In future videos, I'm going to show a setup where you're going to put the electrodes right in the same spot, but to get a more closure is an electrode here and here for closing the fingers. Another video we're about to make is one, a lot of people have very weak shoulder muscles to the point where this bone slips out of the joint. So I'm going to show you a stimulation for what's called subluxation. So I hope that helps. I'm going to check with my camera person, see if there's any questions. No? Good. All right. Thank you.